Well, thank you everyone for joining us this morning. My name is Samaya Tabassum. I'm the Education Programs Lead at the Sexual Assault Services of Saskatchewan, which I'll be referring to as SASS moving forward. All right, so as we gather here today, we acknowledge that we are on Treaty 6 territory and the homeland of the Métis. We pay our respect to the First Nations and the Métis ancestors of this place and reaffirm our relationship with one another. So I'd like to start off by inviting Elder Judy Pelly to start us off with an opening prayer this morning. Elder Judy Pelly is Anishinaabe Saulteaux and was born and raised in Cody First Nation. And she's an alumna of the University of Saskatchewan. And today she's going to be starting us off with an opening prayer. So I'll give off the mic to you. Yes.
I'm just going to introduce myself a little before we get going here. I'm Makatepanechi Ndizhnikas Judy Pelly is my name, my English name. I was born and raised in Cody First Nation by grandparents in the traditional community. I also attended Indian residential school at the age of 6 and was very badly damaged there. It started off my life in a very terrible way where I had no self-esteem and all those things that come with that. So I became, so I'm a recovering alcoholic as well. 22 years I've been sober. I don't smoke and I don't drink. And I also, during that time, I always wonder how I could have done this, but I was, I was sexually abused also at the age of 7. So I'm this subject that is very near and dear to me, and a lot of the people that I work with in inner city Saskatoon. So I eventually became a Dean of Health with SIIT for 21 years, and I worked with many of the organizations here, and as well an education manager in Alberta. So even with all my drinking from 16 to till I retired in 2015, I have really, I was surprised that I graduated and I got 2 degrees. So I now live for the people. I live for the inner core people that are here. This is where I do sharing circles. And not too long ago, I think in July, not this July, but the year before, CBC National did an interview about me, and it covered some of the things I do. And one of the things, the headline was, Judy Pelly works for the most vulnerable population, but also the highest, the CEOs. And I do work with the City Police, the RCMP, the University of Saskatchewan, the University of Regina, many researchers. And I also work with the Saskatchewan Health Authority. I work with mental health and addictions. So my heart, like I say, is with the people, the very vulnerable population. And I talk a lot about intergenerational trauma, because this is where it all came from. Our language and culture was taken away from us, and we became very damaged people. And we know that because we're overrepresented in healthcare, in criminal justice, and in child apprehension more than ever, more than even residential schools. So all those, and then when you look at the disparities in health, we're always at the very top. In systematic racism, we're at the top. So we have a lot of things that we need to work with. But also I wanted to say that I'm very proud to be from Saskatoon. I'm very proud of the community that embraces me. And I work very good allies, the best allies, I think, that work with us, beside us. Nothing about us without us. We want to be involved in every aspect of everything. So the really good thing about TRC Calls to Action in 2015 is that many people are embracing us. We have land acknowledgements. We have pipe ceremonies, and so all those things that are very important to the culture of our people. So this morning, I just wanted to tell you how I was born and raised and how I was taught to say prayers. We use smudging, and we say it in our language the way we were taught by our grandparents and our parents. And I did do that this morning for you at home, because we don't record them, and so I usually do that at home. And anyway, I just wanted to say that in my prayers are included all of you. And I don't say, the Creator already knows what each and every one of you needs in your life and in your hearts. But also the Creator is a loving Creator. And I always encourage people to live the 7 sacred teachings, learn them and know them, because if we all followed them, we wouldn't have the chaos we do in our lives. And I asked everybody. I ask you all to open your hearts to what you're about to hear. This is a very sensitive subject with me as well, being a survivor of sexual abuse. One of the things that I've learned is forgiveness, and I live that life now. I live a free life. I don't have, I'm upfront with everything that's ever happened to me, whether good or bad, and so I don't have any. I live in a fishbowl. So, and then also with abuses that happen, I share that with the girls I work with, because many of them, 90, I would even say 100% are intergenerational trauma, brought on because not only of our women but our men were also sexually abused and damaged, and that intergenerational trauma continues. So putting that into context, and I'm always happy to work with people that we don't forget that what happened, and not only intergenerational trauma, but everywhere in all aspects of society that sexual abuse happens. I remember the Oprah movement way back when she disclosed, and there was a Me Too movement, and it went all over the world and in every community. So I think we're all in one way know someone, or we were. And so with that, I just want to say thank you so much, and what an honor to address this group. And I'm always here for you. When I wake up every morning, I ask the Creator to put me where I should be, and Creator, open my heart to say the things that need to be said. So with that, Miigwech for having me, and an honor to be here. Miigwech.
Thank you so much, Elder Julie. I'll call up Carrie Isaac, our Executive Director of SASS, to give us a little opening remark, and then followed by Isabel Finley from QSAR.
Okay, so good morning, everyone, and welcome. My name is Carrie Isaac, like Samaya said, and I'm very honored to be here today as Executive Director of Sexual Assault Services of Saskatchewan, or we call SASS. I'd like to begin by acknowledging that SASS is located on Treaty 4 territory, but we serve all the treaties that make up Saskatchewan, including Treaty 2, 4, 5, 6, 8, and 10. We seek to work in collaboration with Métis Nations and all First Nations communities to address sexual violence. SASS is a provincial nonprofit organization that works collectively with frontline agencies, communities, and governments to support those who are affected by sexual violence. We envision a province that is free from threat, fear, or experience of sexual violence. We're membership driven. These are our 10 member agencies. I was gonna say them out because I think they should definitely be acknowledged for all the work that they do within their communities and across the province. Envision Counseling and Support Center, which is in Weyburn, Estevan, Carlisle, and Oxbow. Northeast Outreach Support Services, Ashley's here today. Heart Song and Complex Trauma Program in Saskatoon. Hope Restored Canada in Saskatoon. Northeast Partners Family Service Humboldt. Hoapan Women's Center L'Orange. PA Mobile Crisis in PA, Society for the Involvement of Good Neighbors in Yorkton, Southwest Crisis Services in Swift Current, West Central Crisis and Family Support, Kindersley. I know those off by heart. Okay, so what does SASS do? So I guess the misconception is around that we do frontline. Obviously we don't. So we do things like research, like we're sharing today, public awareness and education, resources, training like our FRT, to really shift attitudes and beliefs around sexual violence. We advocate for policies and evidence-based trauma-informed practices. And one of our, I guess you could say, main projects was done in 2019, which we did with QSART, and we released the first sexual violence action plan for our province. It's on the back table there, entitled Working Together, and we're very proud of this document and QSART's involvement with it. This action plan is guiding Saskatchewan in terms of what is needed to solve this issue. It's evidence-based. We took lived experiences from survivors, service providers, and their communities. There's 22 key actions under 4 pillars. Prevention education is the first of the 4 pillars and emphasize the critical role of challenging societal attitudes and beliefs that are normalized and perpetuate various forms of sexual violence. This initiative is in the implementation of this priority around education and awareness, what has been said from survivors and service providers. Learning is healing. SSVE, what we call Saskatchewan Sexual Violence Education Initiative, aims to prevent and address sexual violence and the gender impacts of COVID-19 in Saskatchewan by developing an evidence-based, trauma-informed sexual violence education program. I have to first say thank you to our gracious funders, because without them we wouldn't be here today. There's the Department of Women and Gender Equality, the Department of Justice Canada, and SASS Community Foundation. So as you listen to these findings today, please consider questions that you may have for us or ways in which this research or the resources being developed can support you and your communities. I'd like to call Dr. Isabel Finley to come up and talk more about QSAR.
Thank you, Carrie. Good morning. My name is Isabel Finley. I'm the University Co-Director of QSAR, Community University Institute for Social Research. So on behalf of QSAR and my co-lead on this research, Dr. Marie Lovrod, I want to welcome you and thank you for joining us for the launch of this important work, Learning is Healing. Just to tell you a little bit about QSAR, we've been around since the late 90s. We began in and with the community on the Quality of Life Roundtable, and that has continued to impact our work. We were one of the first federally funded community university research alliances in 2000. And have been doing community-driven research and have been co-governed, half community and half faculty, ever since to our founding in 2000. Our first research focus, as I said, was on quality of life, on community economic development and health determinants, which has morphed over the years to 5 strategic research directions: community sustainability, social economy and social relations, urban-rural community links, Indigenous community development, and university community partnerships, all very relevant to this particular project. Equity and justice for healthy, sustainable communities is at the heart of what we do together, engaging in relevant and rigorous social research that can deepen understanding of our communities and identify opportunities to improve quality of life for all of us. Our partnership with SASS and FSIN, Federation of Sovereign and Indigenous Nations, on the Saskatchewan Sexual Violence Education Initiative is an important part of our ongoing commitment to do research and to act in support of the Truth and Reconciliation Commission's calls to action and missing and murdered Indigenous women and girls' calls for justice. It has been a privilege to continue to learn with and from community expertise on this important topic. Thank you.
Thank you, Isabel, and thank you, Carrie. All right, so without any further ado, we'll get started. So you all have programs on your tables, but we are just going to do the research presentation, and then we'll have a short panel discussion followed by that, and then a Q&A to end off the session. So just to start us off, so the Saskatchewan Sexual Violence Education Initiative, SSVE, in partnership with QSAR and FSIN. So what the purpose of this initiative was to examine existing sexual violence educational programming and then to determine where the gaps are. And then to develop a sexual violence education program that reflects the needs of communities within the province through a trauma-informed, intersectional, and culturally responsive lens. Now, the community research report that's titled Learning is Healing, it highlights the key findings that were discovered in conversations about sexual violence education within communities across the whole province. So learning is healing. Why did we go with that? So this title was an inspiration by Dr. Marie Loverid, who's our principal investigator for this project. So when talking about healing, we often examine what constitutes healing for someone who has experienced trauma and look for the different modalities that support a person's healing journey. So through our research, we wanted to identify guidelines for best practices when developing and delivering sexual violence education. So we want sexual violence education to be a modality for healing and be an experience for the learner that does not cause more harm, but rather provides support in their healing journey. So education can be a restorative factor if the content is developed and reflective of the community needs and reflective of what the community wants to have in terms of content. So just to put things into a little bit more context, so we're gathered here today on the United Nations International Day for Education. Every year on January 24th, the International Education Day is celebrated all around the world, and it's observed to remind people of the importance of education. So to further set the stage, it's important to remember that equitable education, including sexual violence education, reflects human rights and public responsibility. We can't ignore the fact that Saskatchewan has among the highest rates of IPV and sexual violence in the country, and that is rooted deeply in our violent colonial history. We can't talk about sexual violence without taking those legacies into context, into account. So echoing the words of one of our research participants, treaty education is sexual violence education. So when we talk about the topic of violent colonial legacies, we want to share with you the 2017 Human Rights Watch report, which documented 64 cases of violent abuse against Indigenous women by police in Saskatchewan. This mirrors similar reports in BC as well as in Quebec. And this really indicates the legacy of colonialism and how that impacts the relationship between Indigenous communities and police services. Primary survivors of sexual assault within Saskatchewan were living the reports have suggested that primary survivors of sexual assault within Saskatchewan were living with a disability, while national research has found that members of the 2S LGBTQA+ communities reported assaults at rates 6 times higher than their heterosexual counterparts. So that just shows us the diverse nature that of sexual violence and how it's positioned towards targets that are from different backgrounds all across the board. So what does this say? It tells us that the one-size-fits-all approach can leave specific people right out. By creating education that is tailored to one specific group, we're leaving the masses out. So what's the solution? Decolonizing sexual violence education that adopts a reparative approach. And when we talk about reparative education, we're talking about taking into account the specific needs of the community and individuals that are living within that community. Reparative education is the process of repairing what doesn't work by going into communities and consulting with them first to understand their needs, and then to develop education and content and programming that is customized specifically for the needs identified. So our research has found that there's no really comprehensive sexual violence education programming within the province. There's a bunch of things that are floating around. There's a lot of good work that's being done, but no comprehensive framework per se. And the learning gap between Indigenous and settler communities is huge. So the assumption is that the gap is on the Indigenous side, but that's not the case. And these are some of the voices from the communities that we visited. So the idea that sexual violence is something that has been ingrained into us since we were kids. Another quote that we had is, I had a client that couldn't take sex ed because there was incest at home. From little to adults, everyone needs to know what to do when they receive a disclosure. So all of this really signifies the idea that it's deep-rooted within the community. We need to collaborate, and we need to ask the community what it is they need, and then go from there. Another thing that we researched within this project was the impact of COVID-19. In light of COVID-19, we wanted to see how things were changing within the province, within the landscape of sexual violence education. And really, it just solidified everything that we already knew about our systems. It was an X-ray of failures in care, and the service provider workloads had exploded. Every community we visited, service providers were saying that their caseloads are crazy. They're at max capacity. However, that's something that's always been the case. But in light of COVID, what happened is that everyone was trapped indoors, and the mental health of our service providers were equally impacted. Rural and remote communities were hit harder, and a lot of men were seeking supports due to the anonymity factor. We also saw that access and availability of services and supports were impacted. And I think the theme that came around to be is that access is really closely related to available services. However, it doesn't mean that availability equals access. So just because there are supports in place, just because there's trainings in place, doesn't mean that everyone has equal access to that. There is barriers when it comes to transportation in rural communities. There's barriers in terms of childcare. You know, if I want to receive a support, where do I put my kid? How do I get there? How do I get to an urban center that provides these supports? So access was a huge piece that came out in this research. Also, the idea that's reflected within this quote that you can come in to, if your perpetrator is a police officer who's also your boyfriend. So the idea is that in smaller rural communities, everybody knows everybody. So we are going into a situation where your perpetrator may be someone that you know very closely. So how do you navigate that? How do you access supports when the person that you would ask for support is a perpetrator? The idea also flourished that there are no medical professionals that are available to deal with sexual violence when it comes to these rural communities. There is a lack of sane nurses. There's a lack of response when it comes to medical professionals that are able to really support intersectionalities. Also, another issue that surfaced was the fact that incest taboo and how even skilled individuals don't know how to approach incest. And finally, the importance of specialized services for long-term complex trauma was also emphasized. Now, I guess the question that we had is, let's be real, what trauma is not complex? There's no such thing as simple trauma. So at the end of the day, why are we designing services and programs that are for simple trauma, and that's 1 to 8 sessions? Whereas every survivor, every individual that is reeling from trauma needs that long-term care and long-term support. And then, of course, the topic of intersectionalities came up, and this was highlighted with our previous research very deeply as well, and it surfaced again in this research. The idea that tailoring services to individual groups of people, and I can't state that enough. So we have all these different groups of people that we're creating education for, that we're creating systems for, but they navigate these systems differently. And we need to take into account those differences and ensure that we're meeting people where they're at, and we're helping them navigate things the way they can best do it in their reality. All right, so now we'll get into some of the research findings that are specific to the 3 modalities that we use. So we had surveys that were done online, and then we had key informant interviews as well as focus group sessions across 10 different locations. So in terms of surveys, one of the main things that came up was language and how language is a form of access. So ensuring that things are created and translated into multiple different languages to ensure more access and availability. That was a huge thing that came up. In terms of interviews, we also saw the idea of concerns with grooming. This idea of non-duplication and freely accessible resources came up. And also the idea that there is mainstream urbanization when it comes to education and to promote targeting and exclusion instead. Within our focus group, the learning is healing piece came out to be, and the consistency of messaging, the idea that it's so important to have that, and the importance of diverse facilitator teams. So when you're going into a community doing an education piece, the idea is to have individuals that are rooted in that community to support you in that work, so that you know where you're walking into, so you know how to serve that community to the best of your ability. So having access to translation, sign languages, and cultural protocol. And of course, emphasizing decolonization in all of our practices. That was something that also came up within our focus groups. So I have spoken a lot and shared all of these random findings that have come up from different pieces in the research. So what does this end up meaning? Like at the end of the day, how do we tie this all in together? So the key finding or key message that I want to share is the idea of collaborating with community. That is the core piece of this research project. The idea that we have all these unique communities across Saskatchewan, and how do we ensure that we're collaborating with them to ensure that individuals are receiving the best care and education that they need. We did this thing with our focus groups, and I know a couple of you were a part of that. We called it the community co-biography. And really, the way we like to describe it is kind of like a river flowing through a community, and it intersects with all of these different age groups, all of these intersectionalities. So you're having all these people come in as a child, as a youth, as a professional, as someone that's person of color, indigenous, or person that is from the queer community. So having all of these intersections come together, and it really paints the fabric of a community. So how do we collaborate to ensure that all resources are accessible to all of these individuals? Another thing that I do want to point out also is in terms of the geographical area within Saskatchewan and how it's so interesting to see, and this is something that I realized within my travels as well this year, that when we think about Saskatchewan, we're thinking about the prairies, we're thinking about flat land. However, when you travel up north, you really see that there is the boreal forest, there's changes in landscape, and those changes are often left out of the conversation when you think about Saskatchewan. Same way, a lot of individuals in those areas are left out of the conversation when thinking about Saskatchewan resources. So that's what our framework that we have designed through these research findings is here to reflect. So this is what we have come up with the research findings from this report. We're calling it the Saskatchewan Sexual Violence Education Framework. And the idea that embodies this framework is that the facilitator is not always a teacher, but a co-learner with participants. So the way we have structured this is that we have existing programming that is doing great work. And there's a lot of programs out there within Saskatoon, within Regina, within the province, that is creating that space where people can really come together and collaborate in their own learning. And then we will be honoring those, and we're not really here to duplicate anything. So we're championing those resources, but then we're moving on to a piece of collaborating preparation. We're looking at regional demographics, we're looking at mono-industry impacts, we're looking at boomerang referrals, perpetration, minoritization, service availability, trafficking, all of these little pieces when it comes to the different locations within Saskatchewan. We're looking at that. We're doing this collaborative prep with the communities, and we're in each of these modules that will be created will have this collaboration piece before that. So that's the core fundamental piece. So once that has been ensured, then you can move on to the second phase, which would be the core modules and core workshops. So the way we have looked at this is that we want to create something that talks to people and in their communities and really gets a sense of what they need. So we want to start off with rights and responsibilities. And then we have, under the workshops, all of these are customizable and age appropriate and culturally appropriate. So again, the idea that there's community collaboration before we create these so that it can be tailored to each specific group. Some of the topics that we've identified that were highly requested for within the research was informed consent, responding to complicities and perpetration, accountability, and online safety, what you can see. So this is essentially the idea of all of those warning signs that we miss, all of those things that we might be looking out for when we're looking at a loved one, but we're not seeing. Coercive control, rubbing me the wrong way, which is really the topic of working in silos within the sector. So how do we bridge that gap? How do we get in touch with other agencies and other organizations that are doing this work and coming together? Systems navigation, cultural safety, how to be a safe person that someone can disclose to, that someone can share their feelings with, and a land-based healing module, which is recognizing the idea that healing is not linear, it's not just one modality. There's many multiple forms of healing, and it really, really depends on who it is that it's tailored around. So acknowledging the fact that there is other forms of healing that can be a part of someone's journey. So this is the framework in a nutshell, and what we're hoping to do for next steps are really these key pieces. So the community engaged education development team. So really getting a sense of who wants to be a part of this work and can really give us an insight about their community and including them when we're doing that education development piece. And then ensuring that there's a diverse team of facilitators who are mobile around the province. So that is one of the recommendations that we're making for organizations to ensure that they have that capacity, that they're not feeling strapped and they're not feeling like they have to do education on top of their already existing high caseloads. Then we also want to ensure that we are having interprofessional collaboration to enhance the capacity of the sector. This was something that came up over and over again, that we're all working in silos, and a lot of the times we need to really just go across the aisle and reach out and work together. And finally, to champion networks, informal supports, and community building. So informal supports also is something that was really, really interesting to see within our research. The idea that just education, counseling, it's one sort of supports, but there's many other forms that are flourishing, that are also part of a person's healing. So ensuring that we're championing those. And also continuous evaluation for currency to ensure that there's sustainability in what we're doing and it can be improved on and it can be really taken to the next level. And today, I guess what I'd like to leave you with is the idea of centering the margins. So it's about building bridges, making those connections, and being strategic. So the idea that we want to reach across the aisle and we want to work with community to create something that reflects the needs of the community and center the voices that are usually on the margins. All right, so that is the short research presentation that I had for you. So we will jump right into the panel discussion, and we will we ask that you have all your Q&As ready for after the panel discussion. So I'd like to. So I'll just like to start off by introducing our panelists, and then I'll invite them up to sit on that side. And then we'll also invite up Dr. Marie Leverett. She'll be facilitating the panel this morning. All right. So we have Natalia Mason here with us. So she is a community educator and a social worker who was born and raised in Saskatoon. She's a Black first-generation Canadian and a settler on Treaty 6 territory. She holds a BA in psychology from the U of S, a BSW from the U of R, and an MA in women, gender, and sexuality studies. Natalia has spent 8 years working as a sexual health educator and currently works in the College of Medicine at the University of Saskatchewan with the Division of Social Accountabilities. Natalia, I'll get you to come up here. Next up, we've got Ashley Schwanke. She's from the Northeast Outreach and Support Services in Melfort. She's outreach manager at NEOS. Ashley has a background in nursing with an experience in mental health and addictions, serving at-risk youth, injection drug users, and sex trade workers on the streets of Edmonton and Calgary. She has a passion for compassion, and that drives the NEOS outreach team to provide clients with the best strategies, tools, and solutions possible. And finally, we have Alicia Buckley from the Aboriginal Friendship Centers of Saskatchewan, who's been really kind to come join us today with her. So Alicia is a member of the Buffalo River Dene Nation, an urban Indigenous woman. She's earned her degree at the University of Saskatchewan in regional and urban planning and has a passion for engaging the community, building stronger communities and community development. Alicia is honored to help build the Indigenous profile in Saskatchewan while working alongside the wonderful team at the Aboriginal Friendship Centers of Saskatchewan as a program director. While in this role, she worked to gather the voices of Indigenous women and 2S LGBTQ+ in the first Indigenous Women's Economic Framework, which is now being implemented. Thank you, Alicia. Yes, we should clap. And Dr. Marie Leverett, I'll get you to come on up here.
Thank you very much for agreeing to respond to the research that's been done in the recent months. We asked our panelists to reflect on 2 questions in preparation for the day, and if we have time, I have a few more, and I'm sure you also have other questions you might like to ask. So one of the key findings was that basically where you are in the province, who you are, affects how you navigate sexual violence cultures and systems. And they aren't necessarily, systems especially, are not necessarily designed with that sophistication in mind. So the first question was, what can you share about navigating sexual violence cultures in Saskatchewan from your position and what you know in relation to the targeted demographics that you find coming in to your work space? And then the other question that we had was, how would things be different if we had an informed and caring public? Because one of the things that, of course, is produced by our systems is ignorance. And that makes it so much easier for aggression to be sort of facilitated around the community. So I'd like to turn it over to our panelists. And I think, Natalia, do you want to start? Sure. Yep. So what can you share about navigating sexual violence cultures in Saskatchewan based on your experiences and, you know, from different people's perspectives? So obviously, somebody who comes with historical abuse for services, somebody who comes from a minoritized community within that catchment area of service, those kinds of things. Like, it's not as if everybody who seeks services is having the same experience.
My mind started going like 10 questions ahead. I was thinking about a million things, and I wanted to come back to the question that was initially asked. So I actually had the opportunity to facilitate some of the research that was initially conducted by SASS in 2019 and helped to do the data collection that happened in the northern part of the province. And so through my career, I've been fortunate to spend a fair amount of time in northern Saskatchewan, or I think maybe a little bit more time than like the average person gets the opportunity to do. And I've always been really grateful for that. So like on the west side of the province, I've been as far as Birch Narrows, and on the east side of the province, all the way up to like Sandy Bay, Flin Flon, those areas. And when I was with Marie and patients, and we spent some time on back roads and grid roads, moving from community to community, and I had no comprehension prior to that of what access or accessibility to some of those communities actually looked like. And I talk about this one experience that I had while we were traveling because it was really profound for me, and it's something that I still continue to think about today. But when we were in Sandy Bay, I remember Googling, how far is Regina? And Regina's 9 hours away from Sandy Bay. And so being someone who worked in sexual health for a really long time, I know that like a large number of services are only available to people in Saskatoon or for some specialized services in Regina. And so if you're looking to travel that 9 hours from Sandy Bay, you've got to think about transportation. You've got to think about taking time off of work if you're working, finding someone to take care of your children. And none of that is a small feat. And one of the other things that really stuck out to me about Sandy Bay is that in the process of Saskatchewan being settled or colonized, they set up a hydro dam in Sandy Bay. And so they actually physically moved that community a few kilometers up the river. And they said to anyone who wanted to be involved in the construction of that hydro dam that they would be compensated for their work, but they would also be disenfranchised. And so what happened in Sandy Bay is that, I don't know, about roughly half the community doesn't have treaty status anymore. And so they no longer have access to things like medical taxis. And so when we were interviewing people about their experiences with sexual violence and being able to get to like Flin Flon, for example, which is the nearest community, if you didn't have access to a medical taxi, then you had to figure out the cost of transportation and the modality of transportation on your own. And so those impacts are really, really significant and not something that I had ever had to like really consider before. And then in my experience, like working as a sexual health educator, I was in Humboldt one day, and Humboldt's not that far from Saskatoon. It's just like an hour. And I was talking to kids about STI testing, and they said, okay, well, where can we go get tested? Actually, this is a small town outside of Humboldt. This was near to Humboldt, but just outside of that. And they said, okay, well, where can we get tested? And I said, well, I don't know. Like, do you have a doctor here? And they said, yeah, the doctor comes by every 2 weeks. And so I'm thinking, oh, well, if the doctor's coming every 2 weeks, you know, they've probably got other priorities besides giving a 9th grader an STI test, right? And if they can't drive, then they can't get to Humboldt to access services or testing. And so that question of access, I think, is really significant in Saskatchewan. And when you're talking about trying to access services that are stigmatized, that are really challenging, that are tough for you if you're dealing with the complexity of having a family member as a perpetrator or having a community member as a perpetrator. There's so many layers of complexities and things for people to deal with, and that makes it really challenging. And so on one hand, I know that COVID-19 helped to expose a lot of those issues for us and also encouraged us to reimagine how those kinds of issues can be dealt with by offering up like online counseling services or whatever that might be, that those are things that we need to continue to consider when we are thinking about services and who has access to them. And that's not even beginning to open the question of, do those services even exist, and to what degree and to what capacity in like a larger urban center like Saskatoon or Regina.
Ditto. I am actually a nurse, and as in my introduction, I'm the outreach manager with NEOS. And so we're based in Melfort, not that far from Humboldt, and we service the entire Northeast. And we're, I like to think in my brain that we're really far north, but we're not. We're kind of central, but really we're just like right at that tip where you go far north. And accessibility is what it comes down to. When my previous work experience, I worked in Edmonton and Calgary. And when I moved, I met and married a farmer. And so when I moved to a rural location, I was like, oh my God, like, you guys, this is so 10 years ago. And like, you just really realize like how many barriers there really are, and who can access and what services look like. And it's like simple things like transportation. Even me coming here today, it's 2.5 hours. Like, it just, the list goes on, and really you did a beautiful job of summing it up, but that is the experience. But and then you have to get creative. And one of the hardest things I know for myself is, sometimes the answer is there is no service. It's not there. Or like, how do you get somebody there? Well, that transportation doesn't exist. So yeah, that's really all I gotta say right now.
First, I just want to say I don't feel qualified sitting up here next to these two ladies. Yeah, I just want to say, thanks for having me and inviting me. And along that comes with my daughter, who my colleague is busy looking after right now, because I am technically on mat leave. But anyways, when I was asked to do this and saw the questions, I thought, these are some really big questions. And so I emailed back and forth with my colleagues saying, what do I say? What do I do? I'm just going to wing it. Sorry, Brenda. The idea of navigating services is so intersectional. There's so many layers that have to be peeled back. I know my other panelists here have talked about the accessibility, the lack of services, even the comfort level of going to services, things like that. But if you really look at, as an Indigenous person, from my own experiences, it's been normalized for at least 150 years of sexual assault and sexual violence, especially with Indigenous people. We've had a complete erasure of cultures, of Two-Spirit and queer communities. We've had complete erasures of a matriarchal society that's strong and powerful. If you look around this room, sorry to tell you, but there's only one male in here. That just shows, the power that comes from us as women coming together, or as Two-Spirit people. So thinking about navigating services, you really need to think about what that means. It does come back with all of these, issues or access or things like that, but it's also looking at the root causes, really why is there sexual assault or sexual violence? And, in Indigenous cultures, that colonization, that trauma has come down and trickle down through generations and generations. And so, looking at coping mechanisms, why is there not healthy coping mechanisms? Why do we still have, alcoholism, drug abuse? Why are we still seeing sexual violence? It's because we haven't been able to give the appropriate building capacity and appropriate mechanisms in our cultures and our communities to bring that forward. It's really hard to see that our frontline workers are trying so hard to bring these things together, but again, that capacity isn't there. There's so many communities that do have doctors coming in twice a week, but that's obviously not good enough. At Aboriginal Friendship Centre Saskatchewan, we actually don't have clients. Our friendship centers do. So coming from it as kind of a top level, seeing what they go through is so amount. The frontline workers get burned out because they're dealing with literally life and death situations. And so when you're talking about navigating services, they're so busy trying to keep people alive, not to be able to deal with those coping mechanisms and whether or not to find other services for those people. And, if you really look at it, again, in my own experience, it's very rare to come across somebody who doesn't have that trauma. You see everyone has sexual abuse, that has, physical abuse, mental abuse, spiritual abuse, cultural abuse that has come to the forefront. So when you're talking about navigating services and what that culture looks like, we really have to find those supports. With Aboriginal Friendship Centre of Saskatchewan, we've done a similar framework, but it's actually focused on support for economic security and prosperity for Indigenous women and 2S LGBTQ+, but realizing that that's a huge holistic mechanism. If we really look at what it means, we did it using a medicine wheel approach, very holistic, very manured. And so when you see what the community needs, the top need was support. And that looks different to absolutely everyone. It looks different to everyone in a different time. 2 hours ago, I needed to get my baby up, dressed, fed to get here. Now, being here is a little different what my needs are. So just realizing what those are, and everyone has different needs. So if you look at those frontline workers, how do we give them the capacity? How do we give them the education, the supports, the collaboration with other services so that you can navigate those services without having them burn out? So those mental and emotional supports as well. And then if you look at it from the client perspective, it really comes down to what are those coping mechanisms? How do we stop that cycle of intergenerational trauma? How do we go back to that matriarchal and very open, indigenized cultural worldview, because that's where we need to start focusing again. And that's where the supports and things will come forward. So again, it's a really hard topic to come by, because it's so much bigger than just, whether or not somebody has access to transportation, safety, when it comes down to it.
Thank you so much. Wonderful answers. Wow. And this was our experience also talking with service providers in the communities, right? These kinds of insights. So the second question comes back to that notion of reparative education. So education in Saskatchewan has been used as a weapon of colonization. And it's also been used as a way to not pay attention to those histories and legacies. And, whatever you focus on, you're not focusing on something else. So when we think about this particular project, we're thinking about reparative education that changes that sort of culture of ignorance and aggression that facilitates sexual violence. So on a hopeful trajectory, can you imagine how things would be different if we had an informed and caring public, all ages, all communities, right? And one of the ways we talked about this amongst ourselves was, if we had an informed and caring public, if we woke up tomorrow morning and it had happened, how would we know it had happened, right? So love to hear your answers to that.
I love that it's like the magic, like we asked this in counseling, like if you had the magic wand, what it would look like. And I'm like, oh, wow. Instantly when I was reflecting on this question, something that popped into my brain was reporting. Like somebody choosing the process of reporting, how that would be different. And when I think in like a rural context, like what's different about rural is that everybody knows everybody. Everybody knows everybody's business. Like, I never believed that. Like moving to a small town, I was like, no way, it can't be. Oh no, it's true. And so I just think that like if we had an informed public and everyone, just like how much better that process would be, how people would feel like they could report, and how there'd be so many less barriers around that. Because instantly I think of like in a rural community, you might you might see family members or see people within the public, and how it's so much more layered than like, because you're anonymous in the city, that just how that would be better, how people could be safe people and support each other. I hope that makes sense. I'm rambling now. I'm like, it would just change so much. Doesn't matter which way.
First of all, I don't think any of us would have a job.
Yeah. Which would be cool.
That would be, but really it comes down, and I, again, thinking about this hard question, dreaming big, it's definitely something that you really think about, how would we get there? You talk about the Truth and Reconciliation Commission. You talk about the Missing and Murdered Indigenous Women, Girls, and Two-Spirit calls for justice. And you really think about, how do we honor all of these people, all these frameworks, these things that have come before us, putting those in motion. How do we honor these things that have already been set out? But then it also comes down to that truth. We need to be able to have safety in telling that truth, whether you're a victim, whether you're a survivor, whether you're a service provider, whether you're somebody who's, providing that research or whatever you're doing in this realm. There's safety in it. Coming to a safe space like this is a lot easier to talk about it than it would be for somebody who isn't or doesn't feel safe. And with that comes the healing through the reconciliation. How do we move that forward? How do we provide that education moving forward? And so I think that's where it would start. But then how do we build that? When you talk about, again, navigating services, you really talk about how do we support our frontline workers. And again, it comes down to, building capacity within communities. How do we educate others? How do we educate our frontline workers, provide them the supports? And then that really goes down to what those supports look like. Is there ongoing support of stable funding from the government? That would come from an educated, caring public because it's being brought forward. How do we ensure that education is being brought? We, all of this room, continue to learn. We continue to gift each other knowledge and share knowledge so that can be brought forward as well. And then, of course, going back to it, really understanding what everyone needs to be able to bring that forward, to bring that safety forward. I think that's a huge piece, is that, we have safety in every single realm of our medicine wheels, of our personal medicine wheels, of the medicine wheels that we have in our communities, in our institutions, so that we can bring those forward. And that way it would be safe enough for everyone to have, disclosure, to be able to tell their truths and begin the healing process moving forward.
So I'm going to talk about this from my sex ed background, because that's what I did for a really long time. And this is a question that I wrestled with a lot in doing that work, is obviously wanting to empower young people to be able to have relationships that make them feel good about themselves and secure in themselves and to respect who they are. And something that we talk a lot about in sex ed, is this idea called the pleasure principle, which is the idea that if you talked about the fact that your sexual experiences, your romantic relationships were supposed to make you feel good, that we wouldn't have to have all of the other side conversations that are really specific about like STIs or consent or whatever that might be, right? Because you would be really focused on the person who is in front of you and the relationship that you have with that person, and them feeling good and them feeling safe and them feeling cared for. And I think that I feel that I've been brought up in a society that is really focused on power and control and asserting those things over other people in relationships. And there hasn't been as much opportunity to talk about like just relationships with other people and care and mutual respect. And so it would be my hope that if we were looking at a society or a community of people who were informed and educated, we would be looking at people who are able to understand their connections to everybody. And I know that those are really traditional values that we've learned from Indigenous communities, and those are ideas that have been eliminated in the process of colonization. But I think that they offer us such a gift and such a important path forward in building community and building relationship with one another, but that also requires so much vulnerability. And like what I saw with young people so often was not necessarily a bunch of young people doing what they wanted to do, but a bunch of young people doing what they thought they were supposed to do, and following scripts that very much led them into, situations where they were trying to like manipulate other people or exert their control or power because they thought that that's what they were supposed to do. And I think that we're kind of coming to a watershed moment, I hope, where there's starting to be more conversations about sexual violence and power and what that looks like in personal relationships and professional relationships. And I hope that that's I have a lot of faith in the younger generation. I think also when you talk to young people, honestly, like I am this close to being burnt out in my regular work, and I work with adults lots now. And one of the things that always keeps me going is just remembering that when you have conversations with young people, they are completely different from the conversations that you have with adults. They have a capacity for understanding the nuance of relationships and, our existence in the world. And so I hope that they continue to push those conversations forward and that we get to see some change there.
Okay, I just want to check if there's any questions out in the audience before I ask my next one. And maybe you could think about what your question will be after this one. But one of the things we talked about, or the panelists talked about here, was mutual respect. And so when we asked participants in focus groups to think about mutual respect, we said, what kind of conditions would be necessary to have those safe conversations? And, they talked about all kinds of things from unconditional listening, right? Holding space for diverse perspectives, not jumping to conclusions when somebody speaks, right? And all of those, there's zillions of the brilliant things that people said, but all of those also point to how somebody might learn to be a safe person to disclose to. And if we had communities full of folks who were safe to disclose to, again, all those changes that have been imagined by the panel would be there. So when you think about what it would take to be somebody it would be safe to disclose to, like, what do you imagine? How do you imagine that person or that service or that community or that space that would not be the wrong door, not be, the person who says, oh, you need a rape kit. Well, here's somebody with a sprained ankle. Let me take care of them first, right? So I'll let you start this time if you like.
My first initial thought to that question is, what does trauma-informed care actually look like? And it's interesting. Being intergenerational and focusing on my Indigenous side, something as simple as having a baby in the room, or an emotional support pet, things like that. Those are those connections that you have that they're so simple. You light up when you see those things. So that's the type of relationship that you want to have with a person that you're going to disclose to, or that you're being disclosed to. It's interesting because I think every one of us has that potential to be that person. It's just that we have to focus on our own selves. One of the biggest things, is learning about empowerment, learning about how to bring ourselves back to that matriarchal society so that we can be able to, be safe enough in our own selves to be able to give that back and that relationship back to others. Because I think that's where we need to focus on is, how do we make sure that we're okay in our own selves and then bring that back to others. There's that golden rule of treat somebody how you want to be treated, but there's an even better rule of treat the person how they want to be treated. So I think that's the other thing is, after we focus on ourselves, heal ourselves, we treat people how they want to be treated, and creating that relationship that I talked about before, that's how you need to do it, is start building that trust. And it's going to take time. It's not something that's going to happen overnight. So you have to be able to, how do we bring that forward?
I love your inclusion of the platinum rule, because that's one of the things that I taught in sex ed at the very beginning of my lessons almost all the time. Treat other people the way that they want to be treated. I think that one of the things for me that's important, and I always talked about this idea as like being an askable adult, which I think is kind of a similar concept of being like approachable and someone who's prepared to deal with tough issues. And the thing that I always talked about with people is just that the importance of recognizing that you don't need to be an expert. You don't need to have all of the answers. Like, people, when they are listening, are often just listening in preparation to respond to what's being said to them instead of just hearing what's actually being said. And I know, like, for me, I absolutely am always just like jumping to solutions, trying to solve the problem. And that's often not what people need when they come to you. And so I think that just like, the fact that someone has come to you and wants to open up to you is a really good signal, and you don't need to have all of the answers. You don't need to be an expert on whatever issue it is that they are coming to you with, because we can rely on community, right? And like, if you don't have the answers, there are other people out there who have the answers. And so, like Marie just said, making sure that you're never a wrong door. That's actually something that patients said to me when we were originally doing that research, and I have taken that to heart ever since. Just meaning that, like, I might not be the person with the answers, but I'll make sure that I help get you to those answers.
I love being on this panel so much because you two are so brilliant. They like literally, that is exactly what I was going to say, is that a person doesn't have to have the solutions, and it's as simple as like, thank you for telling me. Let me just help you get to somebody who might have what you're looking for or the answer. So that literally was what I was going to say. So thank you.
Thank you so much. Question out there yet? Yes, Patience.
I'll just start us off. One of the things, thank you so much for the panelists. You guys are such a badass team. Anyways, I'm going to stop fangirling now. I think what I keep coming back to personally is like this notion of like stewardship. And I think that's teachings that we get a lot from our, indigenous teachings. But even just this notion that we have a responsibility for one another. And I often realize that what happened with sexual violence is just the neglect that has come, like system neglect from our leaders. And I think, things like not having access to transportation, like that is a very deliberate form of neglect that it's not in the past, and continues today. And I don't know, and I think that sometimes when we talk to people about how sexual violence continues, people don't realize those systems or corporations or individuals that have an active role that may not seem clear and direct, may not be like the hospitals, may not be the education system, but are still contributing to that system of neglect where stewardship is not being practiced. And, I wonder for you guys as panelists, like, have you seen, like, who else have you noticed who is sort of exhibiting that, where maybe for us as just average citizens, we get to be part of that, calling for accountability, to our local MLA, our local city guidance, you know what I mean? Like, I factor in like all the decisions that are being made. Do they think about what are all those ripple effects to people, and how do we hold accountability when that willful, neglect or lack of stewardship is happening, that's costing us lives? Because I think when you think about it that way, you realize that colonization is not in the past. It continues today. I don't know what you would call all of this. And I think the last research that came out from human trafficking, it really emphasized that, what we're seeing for trafficking in Saskatchewan, it's not so much just these people that don't know, what it takes to be trafficked, or it's really about system produced vulnerabilities and system produced, kind of like conditions for individuals, right? So I just ask you to consider, who else have you guys seen that coming from? And maybe for all of us, like, who can we call to accountability from that, from as private citizens even? Sorry for that ramble.
Who would like to start?
Watch me just start naming government agencies. As a sexual health educator, the Ministry of Education was a ministry that I was really focused on. Failure to provide comprehensive sexuality education, which would include information on things like consent, bodily autonomy, all of that stuff. Failure to provide that's a human rights violation. And that is something that continues to happen routinely in Saskatchewan. Tied to what Patience is saying, I think that there is a vested interest on behalf of government, and perhaps not intentional, to create a specific kind of citizen. And that kind of citizen is the one that's going to support their political agenda. And so there is, for a number of nuanced reasons, a reason why necessary education is not delivered to young people, because it will inform how they think as they age and begin to vote and participate in our electoral processes and that kind of thing. And so that would be a really big one. I don't think it's been mentioned yet, but housing is something that came up hundreds of times as we were conducting research, and I know continues to be a really significant issue, from people having unstable housing, or being couch surfing, or living in homes that are overcrowded. While we were collecting data, I heard about families where there was like upwards of 20 people living in one house, and some of the people that were staying with them were maybe not so well known to the family, and so that was creating situations where people or children were being put in a vulnerable living situation. And so I think that a lot of the decisions that impact sexual violence in this problem fall under provincial jurisdiction, and so I do put a good amount of weight in the elected officials in this province and the decisions that they are able to make, because housing, transportation is another one. Like if we think about the STC being closed and how much that's impacted people's access to services, all of those are decisions that are being made by our provincial government. And so I see that as being like a really big priority.
Ditto again. I'm like, yeah. Absolutely. And I know like on my experience of working in, like in nonprofit, a lot of we're funded provincially. I think how we can hold, like what my experience has been is sometimes people are just so afraid because based on funding or based on that kind of stuff of actually giving criticism or like feedback. And I know I had like in the past year, like this little crisis where I was like, we're afraid to tell them that like this is where they're failing. And not by not collecting, like afraid of losing our funding or whatever the case may be. So I think like holding the government and provincial accountable, absolutely 100%, is where it needs to be. Like we need to focus our energy or so ditto. You say it so much nicer.
For me, it comes down to what does that stewardship that you were talking about actually come from? And, that's the privilege, oppression conversation. And so if you really think about it, we have to hold ourselves accountable because we need to know our own biases. We need to be able to share and have those safe conversations to address that privilege and that oppression, because there's so many times that we've heard in our work that there's a client service provider power imbalance, that we've heard that people aren't safe going to places of safety such as the police station, hospitals, government agencies, things like that. There's so many times where, even in schools, there's this one story that I heard from a community liaison at a school here in Saskatoon, where a little boy would come to school Monday morning. He would come in late. His teacher would get mad at him. He wouldn't be functioning. He was hungry. And, she kept getting mad at him. She kept sending him to the principal's office. And so one day the principal said, I don't know what's going on, but we're going to send you to this community liaison person, and you're going to have just a conversation with them. So the little boy finally opened up after months of this and said, I need to stay and sleep Monday morning at school, because all weekend his parents would party, bring in strangers, do whatever. So he would lock himself in his room, put his bed up against the door so that nobody could come in, and he would stay awake the entire time. So he just needed Monday morning to get some rest, have something to eat, so that he was okay for the rest of the week. And so, sharing those stories of how that little boy finally was having that conversation, that safety, to have that conversation with somebody who could then make the right decision to say, okay, you're going to have my office Monday morning to sleep. We're going to close and lock the door so you feel safe. We're going to give you a nice meal, and we're going to give you whatever supports you need to be able to make sure that you're functioning for the rest of the school week or school day. He didn't want, obviously the parents needed to be involved in this, but their conversation never went to the parents of the problem. It was, how do we help support your child? We know that this is happening. We're not, obviously there are some safety concerns, but they started doing a client-centered approach. So coming up with those types of ideas of, holding ourselves accountable, stop and saying, okay, what does this actually need to change? Because I think those were the conversations that need to happen. And so when you're talking about holding people accountable, yes, you can name all the government agencies, you can bring all that, but we need to be able to hold ourselves accountable so that we can, function as that school teacher instead of getting mad, that we can function as the principal saying, okay, let's actually get to the root of the problem, or to the parents saying, okay, I realize that this is happening, but at least you're giving my child some support, moving that forward. So being able to, have that accountability within ourselves first, including all of our biases. We need to be able to make sure that we're recognizing that we are racist as an inherent colonized, society, that we are sexist, that we are, classist. There's so many oppression that happens that we need to be able to make sure that we're understanding that ourselves, so that we can make others accountable as well.
that definitely was a mic drop moment. Any other questions out there? Okay, I have one more. And thank you for sort of outlining jurisdictions, because I also think that is a game, right? That this is a federal jurisdiction, this is a provincial jurisdiction, this is a municipal jurisdiction, and they just kick the ball around. And so that's very frustrating. But then identifying ourselves as an accountable jurisdiction, I think, is wonderful. I just want to make a comment. It came up in the slide, but one of the things that was evident because of the COVID impact was that because services had gone online, some men were more willing to come forward because they could use online spaces to be anonymous. And one of the really weird things about services in Saskatchewan is there's this assumption, especially around the question of everybody knows everybody in rural spaces, that you should go for services in your community. And sometimes that's really hard to do. And so, just everybody had this sort of lesson in access, including could we deliver services in ways that would protect that anonymity by letting people engage in, safe telephone spaces or safe online spaces, or finding ways to have conversations in particular demographics so that people don't have to worry about the next door neighbor finding out, right? Okay, so that's one part of this question. And then the other part is also that because colonization, the land grab that continues, is ongoing, there's also this kind of emptying out of rural spaces, which means that, business interests have to be very fierce in those spaces. And so another topic that came up was not only the need for anonymity in spaces where everybody knows everybody, but also the fact that often if there's, let's say, sex work happening, that money is being laundered in the community with a business that sits at the front pew of the local religious organization, right? And so, how do we think about these conditions where both there's kind of a structural facilitation of different aspects of sexual violence, but then there's also different ways of delivering services. And both of those questions in the interviews and focus groups came up around the demographic of men. Doesn't necessarily always have to apply to men, but I'd be interested in what you think about that. So who would like to respond to some part of that question?
Okay, so my head's going in a couple different directions. First of all, I think everything needs to be individual approached. Everybody, like I said, needs different supports at different times. And so how do you provide that support? You talked about, how it could be everyone's business, and we need that anonymity. But in some spaces or some individuals, they'd prefer to talk to their local elder. They'd prefer to have that connection with that somebody, while some others would rather have that anonymous, connection, because then it doesn't get out to the community. So it's definitely something that everything needs to be around an individual and what they need or what they have for supports for themselves. In regards to the men question, I remember me and my colleague, our executive director, Laurie Bouvier, were on a call with multiple federal, provincial ministers, and one of the questions that came out, because it was around MMIW G2S, is should men and boys be included in the conversation? And 100% yes, they do. I'm going to tell you a little story just to kind of reiterate this. I was in L'Orange. We were having a discussion with a mom whose son had passed, so a missing or a murdered Indigenous man. And what happened was he was supporting his girlfriend, who she had a mother who was missing. And so, you know, he would be at the forefront of the walks down L'Orange, the main street. He would be the one, you know, going to the ministers and saying, we need change. He'd be the one moving the calls for justice forward. And so him raising his voice because his girlfriend was too scared to was where his downfall happened. Her ex came in one night, shot him in bed because he was well known to the community. So these ripples that happen within our communities, we see it all the time, and that's where that trauma, those community things happen. And so as much as he was doing good and was, you know, held liable for it, his legacy now with his mother and his then girlfriend is that, yes, they need to be in those conversations so that the man who did the act can be held accountable. We know that if we're not whole and our communities aren't healed altogether, with men and boys included, there's major reflections. That ripple gets bigger and bigger and turns into a tidal wave, a tsunami that we can't control, which is what's happening now. So how do we provide those individual supports down to it, whether it is online, if they have access to internet, or devices to access to internet, or whether it is in person with an elder in the community, or whether it is with a service provider who does provide that anonymity. You know, there's every possible way that we need to have those relationships to make sure that we are able to provide the supports to that person and supports to people around them, whether it supports the victim, whether it supports the victim's family, supports the offender, whether it supports the offender's family. Those are all the things that need to be included in the community healing process so that we can move forward.
Something that I've definitely learned over COVID is that we moved our services to be hybrid approach. And we have definitely found that because there isn't a one size fits all, that it just improved accessibility. But then what's really neat is it provided that option for people to seek the services outside of their community. And so I just know that in order for us to really get the services out there and to have it accessible to everybody, that we just have a diverse option. And I know, like in my programs, we have seen that be successful. So that was one positive that came out of COVID for sure.
Just going to answer this question in 3 pieces. So I think my first thought is yes, that having choice in how services are provided is really valuable. When we were conducting the research, we spoke to people in communities about like what their ideal service delivery model would look like. And I think that we heard half the time that people wanted anonymous services and someone who didn't know them. And then the other half of the time people were saying, I want someone who understands my context. But you know, you're in a community of 200 people, so everyone who understands your context is also going to know you quite well. And that was like a really interesting challenge to navigate at the time, and that was 2019. And I think one of the things that, if there was an upside, a silver lining to the pandemic, was just seeing that the delivery of services in alternative fashions is possible, and that's something that lots of communities have been asking for a really long time. Even I think about like the disability community specifically has been asking for clinical service delivery online, and that's possible now. So I think options is really important. In terms of men accessing services, like, yeah, there's certainly a lot more stigma. I'm also interested in restorative justice and what that looks like. And I know that that's an area that still, I think, has a lot of room for growth in conducting that research. I remember being in a community and someone said that like 9 out of 10 people in that community would have experienced sexual violence, which also means that the vast majority of perpetrators of sexual violence themselves had experience as survivors. And that's really complicated and that's really nuanced. But I do think that restorative justice is going to be a really critical component to helping to resolve those kinds of issues. And I've participated in kind of like a similar process in Saskatoon through a local organization where I worked with a kid who had been picked up by the police for trying to solicit a sex worker. And I would, of course, say like sex work isn't inherently harmful, and the circumstances that it's happening in are going to also be like really nuanced and complex. But if I kind of go back to that idea of like scripts and kids doing what they think that they're supposed to do, like I think that this kid was like, oh, if I go see a sex worker, I can become more experienced and not have to deal with like that peer-to-peer risk that I have to manage, that emotional risk, that social risk, and like a relationship with someone my own age. And so for a lot of reasons, I could kind of like understand why that decision was made. But there's also a necessity to be able to understand that there's like a different power dynamic happening there, let alone the fact that this kid was underage and that was like a whole other issue. But I think that the most challenging piece about all of this is just having the space to have those conversations in a way that's nuanced and acknowledges like kind of all of the complexities that are at play, because all of those situations exist in relationship to one another, not independent from each other.
Thank you all so much. That really was fabulous. I just want to say in response to the comment about sex work too, there's also all these narratives out there, right? Like that young man did not come by that narrative. You know, he didn't make it up in his head. He saw it in the movies, right? And so, we have to think about how we construct sexual violence as part of an identity formation process. And, that is definitely something that careful education can address. So I just want to say thanks again to the panel, and I'll let Samaya take us home.
Awesome. Thank you. Thank you all for being part of this panel. I'd love to call up Carrie again for some closing remarks, and then we'll be done for the day. We got a little something for all of you. It isn't. It definitely isn't. And Alicia, thank you for bringing the baby along. This was the energy that we needed. No, I'm so happy to have the energy here. Awesome.
So closing is going to be our thank yous, basically. I first obviously wanted to start our funders, once again, our 10-member agencies, our board of directors, and I also wanted to special thanks to the Federation of Sovereign Indigenous Nations. Chief Ali Bear was unfortunately unable to be for this one, but she's coming this afternoon, so we greatly appreciate her support and leadership. So I had actually, do you want to do your stuff first? Sure.
Yeah, we all have our own thank yous. So I first of all want to thank all of you for joining us, all the panelists today. Elder Judy, thank you so much for coming through today, this morning. I want to thank my SASS team, all three of you that are here today, my ED, Carrie, Patience, and Ashley. Thank you for all the support. And a big shout out to Aspen, Riley here. He's doing all of our video work today, so thank you for that. And then in addition to that, I just want to extend my big thank you to Dr. Marie and Dr. Isabel here from QSAR. This research wouldn't have been possible without them and the communities that we visited. So all of the participants, I know some of you were here today, the ones that were in the communities. So thank you so much for your support, your hard work, and continued work in this sector. So thank you, Marie and Isabel. I'll give it back to Carrie.
You took one of my thank yous. I was going to thank Samaya. She has literally been working crazy. You should talk to your boss. And the SASS team, we're very small but mighty. And yeah, it's just great working with such a great group. I had this really mic drop thing to say about everyone in the room today has the ability to challenge this issue. And I thought about it sitting there. I'm like, this isn't the room that I need to say this to, because everybody is doing this. So I just really wanted to thank everybody in the room for your leadership and your advocacy, and yeah, just honor all you guys and the work you do. Thank you.